welcome to the Department of Anatomy, Sri Sathya Sai Medical College. Today we are going to demonstrate the thorax and the contents of the thorax. First of all, let us see how the thorax are covered. The thorax are covered by 12 pairs of ribs, that is true ribs, false ribs and the floating ribs. This is the sternum, which gives the support to the ribs to join. The part of the sternum, it has been removed. The part of the sternum, this is the manogram sternum. This is the angle of pleura, or that is called as the sternal angle. This is the body of sternum and xiphoid process. After removing this is the mediastinal surface. The two lungs are present. The one of the lung has been removed. This is the left lung and here comes the right lung. This is the mediastinal surface where the heart is situated. So the lung. So first of all, the lungs are covered by the layers. That is two layers, visceral layer and parietal layer. Here comes first we are going to demonstrate the parietal layer. How does it cover the lung? The parietal layer is divided into, here comes cervical pleura, the pleural cavity. So the parietal pleura covers the parts of the parietal pleura or the divisions of the parietal pleura. How does it covers the lung? It is divided according to the parts where it is covered. The first comes the cervical pleura. It covers the apex of the lung. Then comes the mediastinal pleura. Here it covers the whole except the hilum. The opening, it will not cover the hilum and it covers the rest of the mediastinal surface. That's why it is called as mediastinal pleura. Then comes the diaphragmatic pleura. Here from the diaphragm on this diaphragmatic surface of the lung, it covers the diaphragmatic surface of the lung. So it is called as a diaphragmatic pleura. Here comes the costal pleura, which covers the whole costal surface. This is called as the costal pleura. If you remove now we have removed the lung. So after removing the lungs, the structure what lies on according to the medial side of on the vertebrae is this is the sympathetic trunk. These are the nerves. This is the trunk, sympathetic trunk, and these are the branches of the sympathetic trunk that is called as intercostal nerves. These are the intercostal nerves. And the blood supply and the venous drainage of the intercostal spaces or the intercostal muscles that cover the ribs. So here comes the two vein and artery. This is the vein and this is the artery which supply the blood and which take the deoxygenated blood from here. We will see the border. Now we will see the borders and surfaces of the lungs. How the lungs are covered. Let us see. This is the visceral layer of the lung. Visceral layer of the lung, which covers the whole lung except the hilum, the opening. And after that comes the borders. It has three borders and two surfaces. This is the anterior border of the lung. This is the posterior border of the lung. And and these are the hilum. This is called as an opening. Here we can see where the trachea, the bronchi bifurcates and comes into the lung. And this is the pulmonary veins which take the oxygenated blood from the lung to the left atrium. And this is the pulmonary artery. We get the blood from the right ventricle, deoxygenated blood from the right ventricle to the lung. After that, we have saw the two borders, anterior border, posterior border, and the lower border. This is the lower border. And the impressions. The left lung shows the impression of the heart. That is here comes the right atrium, left atrium and the left ventricle. So this is like a sandwich. This is a sandwich. So this wall between the heart and the parietal pleura, it is been sandwiched in between. This is called as a lingula or a tongue shape. This is a part of the lung. The surfaces. This is the mediastinal surface of the lung, and this is the costal surface of the lung. The left lung is divided into the upper and in the superior and inferior part by an oblique fissure. This is the oblique fissure. Is separated by an oblique fissure. We separate the upper lobe and the lower lobe of the lung. In the right lung, we will have the oblique fissure and the transverse fissures also. That was the thorax. Next we will continue by the heart and what are the contents of the heart.